Welcome to this special episode of Eureka, which is on COVID-19. In these special episodes of Eureka on COVID-19, we interact with Indian scientific institutions and then discuss about how they play a very vital role behind the scene to fight this pandemic. The frontline workers are, of course, the medical professionals and administrators and others, but the science has a very important role to play, as you can see in this episode. In this episode, we are going to have this conversation with Dr. Arun Bandyopadhyay. He is a chief scientist with Indian Institute of Chemical Biology at Kolkata. Sir, thank you for being in the show. It's a very wonderful opportunity. Your institution is a very well reputed one and a very old institute, which has had a significant impact in Indian health sector, particularly its work related to Kala Azar is world renowned. Now we are facing this huge challenge of COVID-19. Indian science has to buckle up and support. And in the recent past, we have seen in media that your institute has started to work on plasma therapy. It's something novel. So we would like to start our discussion with that. What is plasma therapy in a simple word?
Yeah, I'm coming to this. First of all, thank you very much, Dr. Venkateswaran, for including me in Rajya Sabha TV. And it's my pleasure. Yes, IICB Kolkata is a very pioneer in infectious disease research. And you know, a long time back, our founder director, he first tested oral vaccine against cholera in IICB.
Yes.
And much later, oral polio vaccine become popular.
Yeah.
So IICB has a legacy, good legacy. And interestingly, for plasma therapy, IICB is playing a leading role. And recently, the IICB, along with West Bengal government, has got the permission for clinical trial for plasma therapy. Basically, it's taking antibody from the patient who has recovered from COVID-19 and perfusing into the patient who is suffering from COVID-19.
That is essentially the central part of plasma therapy. Right? So this is essentially something similar to a blood transfusion. So which means that do we have to look at blood grouping so that only people who match blood grouping will be able to be given this plasma therapy, or it is not?
Actually, it is better to check the blood group because you are giving huge amount of blood. Say 150 ml like of plasma. You are taking plasma, giving plasma, but still blood grouping is necessary. And in our trial, they are checking the blood grouping. The donor and the acceptor also.
So you used a word like antibody. Antibody which is present in recovered patient. What does this antibody means in a recovered patient?
Yeah, it's very simply to say that that is our first defense against any pathogens, any infection. So our body is the first responder. We have a system to respond against any infection. That is the ideal system, and that is evolved over the thousands of years evolution. And so fortunately for COVID-19, against COVID-19 also antibody will be generated after a few days, and that is generated. So the patient who has recovered, and also many asymptomatic patients who are also fine, they are fine, but they had the infection, they are also having this antibody. Now this antibody is a source for the therapy against COVID-19 in the patient. And this is a very basic concept of immunology.
Okay. I was told that for every specific pathogen, let's say, for example, a specific virus like a novel coronavirus, a specific type of antibody is secreted by our body. So, for example, the antibody that will be secreted because of, let's say, you might have had some other viral disease, let's say flu. There may be antibodies secreted, but that won't be effective for curing COVID-19. Is that right? I mean, the antibodies are very specific.
Yeah, it's correct. Like you are correct. Antibody is very specific against pathogen. So any pathogen, so it's very specific to COVID-19, dengue. But some cross reactivity of antigen antibody may happen with this dengue. That is, some people are thinking, and IICB is also doing research. But in generally, the antibody is very specific. So the antibody which is raised in the body against COVID-19 will be effective for COVID-19 treatment.
So it is something like, say, for example, the dogs which the farmers use. I mean, some places in the farm they may have snakes. So the dogs that the farmers use will be able to detect the snakes because they have been trained to detect that. So yeah, antibody works like that, right? I mean, a specific pathogen that comes in.
Right.
So another question that I have in my mind is when you actually get infected with the virus and your body generates the antibody, then its protection is almost lifelong, right? I mean, for COVID-19, the novel coronavirus, we don't know exactly whether it will be lifelong, but most likely, given other understanding, that it's going to be most likely lifelong. So, but if I get treated with this plasma, will it be lifelong or only for the duration that actually the transferred plasma is there in my blood?
See, basically, you treat with the COVID-19 plasma, the who has recovered the COVID-19, but the patient who is being treated, he will eventually develop antibody.
Okay.
So you are just giving support for some time, but I think after eventually he will develop antibody.
Okay, so it is like this plants which need some support to grow, right?
Yeah. In fact, if the patient who are not getting any antibody treatment, they are giving some supportive treatment like secondary, some other medicines, healthcare support. They are also having antibody. So antibody will eventually develop.
Very. So how is this study conducted? Like, I mean, you just give it to some patient and see whether they are cured, or how do you do that? I mean, what is the process by which you know that this plasma transfer has effect?
Yeah. So this is a correct question. It's a right question. Very important to know by the people, because see, before you say anything is effective, you have to have a trial, clinical trial. For drug also you have to have a clinical trial. Yeah. So the clinical trial is actually the test to check the efficacy of the proposed therapy. In this case, a plasma therapy. So there are two groups of people. They will select. They will divide two group of patients. One patient who will not get any treatment. They will get treatment for normal healthcare support, COVID-19, but healthcare support. Another group will get this plasma from the recovered patient. And now they will check after, say, 1 or 2 consecutive days, they will be treated, maybe 3. It depends on the exact protocol these doctors are doing. And then they will check they recovered or not. So few number of people they will check first, say 10, 20 patients, and then they will they analyze the data, how it is, whether it is by chance or it is really by because of your treatment. So there's So from
you'll be able to finalize the efficacy of this treatment method.
From IICB, we have a doctor, scientist doctor, Dr. Deepaman Ganguly, and his team. They are basically immunologists also. So they are leading from IICB, and the other doctors are there, practicing clinicians are there in government hospitals.
Okay, that's a very nice stuff. I mean, but how long it will take for you to find out whether this treatment procedure is useful or not?
I'm not sure, but I think it will say within maximum 1 month. Within 1 month, people will come to know, at least will get some idea.
Okay, so whether this treatment is efficacious or not, whether it is something that we can bank up or not, will be clear.
At least
this treatment cannot be given to people who are already reached kind of very severe stage, or it can be given at any stage.
At this moment, it is very difficult to say, because it depends on the data they get it. So they will decide.
Okay, that's nice. That's a very nice thing. And I have a slightly different question now. I mean, your institution is a very old institution with a lot of capabilities. Correct. Now, even if we look at, for example, a simple thing like a PCR test, because this virus is a very dangerous virus, I mean, you cannot examine this virus in usual laboratories, like a blood test or anything, you cannot do it. Even if the technology is simple, but you cannot do it because of the nature of virus itself. I mean, you need at least a BSL-3, BSL-4 lab. So how your institution has repurposed itself to help fight COVID in your local area?
Yeah, so it's very correct that you raise that issue. This is the point where scientists become very relevant in fight against COVID-19.
Yeah.
Because see, from the very beginning, WHO and also our healthcare experts by ICMR, they suggested test, and test. But what is a test? Test is, by that time, people came to know that test is PCR-based test. So PCR-based is the gold standard for testing COVID patient. And but these tests require some sophisticated machine. Not only the BSL-2 plus is enough facility, but also needs sophisticated machine like PCR machine, and also expertise to run the PCR, which are not very commonly abundantly available in our system, healthcare system. There are some molecular diagnostics facilities, but not that abundant.
Okay.
So, but these are very common in our R&D laboratories all over India. Not only IICB, most of the institutions who are involved in biology research, biochemistry research, molecular biology research, in any lab they have the real-time PCR machine. Almost every scientist have their own real-time PCR machine.
Okay.
Because that's the bread and butter. So, interestingly, immediately after lockdown, the 23rd, 24th March, I got a call from a doctor from Command Hospital, the Army Hospital, that he's Dr. Ganguly. He's Alexander Ganguly. He's a chief pathologist there. Okay. He asked me to provide one real-time PCR machine for some time. They will return back for COVID-19 test. Okay. And I said, okay, it's good. Let's help them. And then immediately I went out. So the army they sent one jeep to my complex because it was complete shutdown. Okay. And I arranged my students. I went to the lab. I immediately gave my own real-time PCR machine, which is used in my lab, which is completely optimized and everything is set. And then I also sent my student there, and student there visited there. He set up the facility, and later also he went there with the lab, and he completely unpacked the kit and they showed how to do it, and they got the permission.
Okay.
That's the way we not only help bring the machine, but also by intellectual help, the way we can and run the protocol. Still, they are in contact with me and also with my student for any kind of problem we face. Okay. And you know, the Command Hospital is doing a wonderful job because they are doing a lot of tests. They have responsibility to test the Howrah district patients. Okay. And so this procedure was very well, and they appreciated us very much. They have sent a letter of appreciation to us, and we also feel proud that we can actually help them for this. Following the same model, we donated 2 machines to RGCon Medical College. Another is a medical college in Midnapur Medical College. And then health department from West Bengal government, they approached us to set up a complete facility in Raiganj Medical College. All the other instruments. So it's a kind of 10 instruments. So 10 instruments they suggested to give us. So we had a joint project now. We developed a joint project. And after a lot of formalities, we sent 10 to 11 instruments, and then they are setting up there. They will get permission from ICMR very soon, and they will start. So it's a joint project there. And the other way, like in our IICB Jadavpur campus, we have a BSL-2 plus facility. We have already set up there. We have a virologist and his team. So we are waiting for some collaboration with government hospital. So we can also trust COVID testing in our facility.
Okay, so this is an important thing because now when the pandemic is raging, testing is a very, very important aspect. And then there are not, as you said, many facilities for actually doing the test because of the kind of involvement it requires. And your institution has quickly repurposed itself, not only made your institution available, but also set up this in many other places. That's very commendable. This is where we'll take a very short break. Keep watching Eureka. We'll take a very short break. After the break, we'll continue and talk about how their institute has found the coronavirus can possibly infect a certain part of your brain. Keep watching Eureka after the break.
बुखार, थकान और सूखी खांसी कोविड-19 के सामान्य लक्षण हैं। इसके अलावा कुछ मरीजों को शरीर में दर्द, नाक बंद होना, नाक बहना, गले में खराश और डायरिया जैसे लक्षण भी देखने को मिले हैं। कोविड-19 से संक्रमित होने पर कुछ मरीजों को सांस लेने में तकलीफ जैसी शिकायत भी होती है। डॉक्टर्स दिल की बीमारी, शुगर और ब्लड प्रेशर के मरीजों को ज्यादा सावधानी बरतने के लिए कहते हैं।
Welcome back to Eureka. We are having a very excellent, very enlightening conversation with Dr. Arun Bandyopadhyay. He is a chief scientist with Indian Institute of Chemical Biology, an institution under CSIR in Kolkata. Before the break, we talked about how they are involving themselves in plasma therapy and also repurpose themselves to provide testing facilities in West Bengal. And now, a very important result that has come from their institute, which has actually stunned the whole world. Sir, newspapers talked about your research work that happened in your institute, where the findings are the infection of respiratory tract, although is the mainstay of a novel coronavirus, perhaps it can also enter brain and perhaps infect there. Can you explain to us what is this?
Yeah, first of all, I want to say that this findings is not done based at the not research done in the laboratory. This is basically a view. A view is published in a journal, and this is a prediction. Okay. So no experiment is done, as per my knowledge. But they predict based on the data available, and they wrote a review, and it's their view. Their view is that it can, through nose, it can go to the brain, and it can affect the respiratory center to control the respiration. So they think that because of this, there is a respiratory trouble. So it's a purely predictive thing. So no wet lab experiments are done yet, as per my knowledge. These faculties are in our Salt Lake campus. I know them very well. But this is a view. So it is published as a view.
Okay. So not even wet lab has been done, or clinical studies are also yet to happen, right? So this is a kind of a prediction based on the novel coronavirus, their structure, etc. Right? That's a. So here is another question, that one of the area that your institute is working is looking at the proteins of novel coronavirus and trying to see which are probable for drug target, vaccine target. Can you elaborate on us what exactly it means?
Yeah, we have another group, the bioinformatician group. So they are also trying to, based on the available data. By this time, large number of data are there. So, and also using the sequence, the data, they are trying to find out this some target based on their modeling, and that also needs to be validated. But there are some basis on that, because of the large number of data is by now available. Based on that, they are predicting.
Okay. So what does this actually targeting a particular protein means? I mean, what does it actually entail? I mean, is it some kind of a computer simulation in which you try to see how the viral protein will look like? Right. What will be the methodology? Can you explain to us simply in a simple word?
Yeah, their main purpose is to find out this variation. West Bengal variation is any mutation, and also whether the spike proteins are changed, altered, and that those can be target for any drug.
Okay. That's a. There is also another work that your institute is doing, which is sequencing genome.
Right.
So, but the very first sequence was done in China. That's how they actually found out that there is a new virus, right? Yeah. So, but why do people sequence so many times? I mean, why should we sequence constantly? Is it not enough that once we sequence that we know how the virus is? I mean, then what else to sequence?
Yeah, it's a very good question, because the virus, changes. Virus changes structure. So it is not necessarily that whatever variant is available in China is available in India. In India, by now, there are many types of already all people discovered. They have sequenced. Sequencing is done by many other institutions and many locations. And IICB is also joined there. So you need to sequence more and more variants. So that, see, there are two ways. Number one, you get some mutation, some variation, change in the structure. That doesn't mean that it will be effective in the pathology. It may not be affecting the pathology, but there are some mutations which will change the pathology. Its behavior, its virulence, everything will be changed. So that is why it is necessary to sequence more and more number of variants, virus, and understand its behavior.
Okay. So you pointed out something important. I'll come back to that, but I'll go back to your mutation. See, when you do PCR test, I mean, you use a primer, which is essentially one part of the sequence of the virus.
Right.
So suppose if the mutation has happened in that part, will not your PCR give you error? I mean,
yeah, obviously, if there are mutations in there, but how this PCR test is being done, they have 3 sets of primer.
Okay.
3 sets of primer.
Okay.
So primer means they are actually extending this by amplification, they're amplifying 3 regions.
Okay.
3 regions primer, 3 sets of primer. So 3 different sets of primer, and so therefore, during the experiment, you need 3 well in the 96 well, 3 into 2, so 6 well goes for one patient.
Okay.
And then we have to have positive control and negative control. So they are actually doing PCR from 3 different regions, and mostly I know I'm not sure, but these are the regions where mutation is very less.
Okay.
So it's not necessarily every mutation will happen randomly in all these places. The bases are there based on there. So this PCR, the primer, which the sequence which are used to design the primers are normally not changed, and there are 3 sets of primer. So
and in fact, when you actually sequence genome, and in case if there is a change, that also something that you will actually find out, right? I mean,
that also discovered. Yeah, that's what we realized if you do sequencing.
Yeah. So you see, you use certain terminologies, and then you are also saying something, because I need to ask this question because a lot of fear and misinformation is spreading in media that whenever a new variant is found by somebody, that people start saying that, oh, there is a less virulent strain that has come up, or that is why we are dying so much. I mean, people start ascribing character to that variant. No. Yeah. So there is a difference between variant and a strain. Can you explain to us a bit more, because this is an important area where a lot of people have misconception.
Yeah. So its character is changed. It's complete new strain is developed, and variant, some small minor changes are there. So it may not be very effective, and because of these changes in the structure, may not be very virulent. It's a random event. So because of these random events, the virus may lose its severity, virulency, or may be virulent. So you don't know, because it's very new things and it is coming regularly. So of course now 2-3 months, many data is acquired throughout the globe. So after a few months, maybe it will be revealed much better way.
And also that if there is a variation in the genome sequence of this virus, it does not immediately mean that whether it's infectivity or disease-causing character will immediately change. You need experimental evidence for it, right? I mean, clinical evidence to make that claim.
Just that we can relate with pathophysiology. Yes, it is related to his virulency. You have to do the experiments, you have to do virus culture, and to culture the virus, you need a very good facility because this virus is COVID virus.
Yeah.
So like in IICB Jadavpur campus, we do culture the other virus like dengue virus, but coronavirus we are also planning to do there.
Okay.
So because there is strong demand for drug testing and other things. So unless we culture coronavirus, COVID-19, you cannot say, okay, this drug is effective or not. For drug screening, you need to do a coronavirus culture.
This one I'm going to slightly expand. So you are saying that artificially one would culture the virus in laboratory in a test tube, and whatever is a drug which we think may work, you will administer to that test tube and then test whether the drug is effective or not, right? Can you elaborate on this?
Yeah, so you culture the virus and you have some drugs, some existing drugs, antiviral molecules. We are also working on that, and you repurpose those drugs. The existing drugs you repurpose for coronavirus, and you change all the structure of the molecule and then check the efficacy. So for those, you have to have a culture system. In one set, you don't give any molecule. You give something, mock thing, some buffer or some, say, water, something like which is not effective, or some other molecule, and which is not COVID-19 effective. And the other plate you give COVID-19, the drug, to a potential drug for COVID-19. And then you check the growth of the virus. So virus growth you will check while some assay is there. And that's the way people check this, the initial screening. So then, say, out of, say, many molecules, you find out which is the more effective. Then it goes for the trial, clinical trial. Whether this molecule is toxic or not, so phase 1. And then in phase 2 trial, you have a small some small sample, few patient. You check the efficacy, and then you large a clinical trial. It takes a lot of stages and time. But the existing molecules which are already tested, so that's tested for other viruses. So you can repurpose those. So that's our CSIR mission also, big CSIR mission in which IICB chemists are involved, and we have responsibility to synthesize those molecules, to synthesize the root of this molecule, so that our industry can take those and synthesize in the huge quantity in their factories.
So basically, some of the old drugs which may be used for some other disease, if we find for COVID, how to produce in India, that's a challenge that your institute chemists are working, right? I mean, that's what you're saying.
Yeah, that's a big challenge, and CSIR is very much involved. Not only IICB, CSIR has a particular goal, and IICT Hyderabad has a big project along with other institutes, and IICB was also part of that project.
Very, very nice. So now let me move to a point that you say that you are growing dengue virus in your institute.
Yeah.
So there is also some talk that dengue virus and novel coronavirus, some link that your institute people are studying. So can you tell us about that?
Yeah. So because our virologist is there, so he thinks that also some data there in other country, China. So they said that if you check with say now antibody test, I'm coming to antibody test. So government is also trying to do antibody test. So to check whether he has already recovered or not. So we check with antibody test, so serological test or sero test, and then if there is they think that maybe if somebody is infected with dengue, dengue antigen can react positively with this antibody, or other vice versa. So it may mislead the information. So that's why he's trying to do this both the way. He has a kit, serological kit for dengue. He has a kit for serological for coronavirus, and then you can test both the way. So because there's a scientific basis for that kind of prediction, because in India, especially in Kolkata, in this region, there are a lot of dengue infected people, and many people are already infected with dengue. They may not know. So the antibody is already there in the titer.
Yes.
That's the prediction. That's if before you check this with the serological test with coronavirus, you check with dengue also. So that's he is thinking. So he's doing some research. It's very different, but it's worth doing this kind of research.
Very nice. Very nice. I mean, one can see that your institute has multiple areas in which your institute is working, and the institute scientists are repurpose themselves for the current contemporary times in the pandemic when we have to face. It's been a very, very wonderful conversation, and thank you for being with us in this show. It's a very enlightening conversation, very different areas that this kind of institute plays its role. We can understand from this. Thank you for being in the show. Keep watching Eureka. We'll come back with another interesting conversation next week, same time.
Thank you.